says that doesn't have to be the case. Here to tell us how almost anyone can get those perfect teeth. Welcome, Dr.
Hi, Deborah. Thanks for having me on the show.
Gum disease is just, it's one of the most prevalent types of issues, medical issues that people deal with around the world. And what I want to point out is that not every dentist or doctor is equipped to deal with certain situations. So explain to us what your specialty is.
My specialty is oral and maxillofacial surgery. Basically, we're surgeons of the teeth, mouth, and face. So we do a lot of different surgeries, both on the medical side and the dental side.
Yeah, so some reasons could be because of injury.
Exactly. We do a maxillofacial trauma. We take call on the hospitals. If you broke your nose, we could fix it.
Yeah.
But we also deal with a lot of teeth issues and also a lot of mouth surgery as well.
Okay, dental implants. Fairly recently, they've been able to do these dental implants that really act like your own teeth. However, lots of patients have been told, you know what, you got too much bone loss. This is probably not something you can do. So tell us what it is that we need. First of all, what are some of the reasons people might need those dental implants? And then why some people may be turned away?
Well, there's a lot of reasons for patients who want dental implants, and they often come to our office with the expectation that they've had some kind of accident or injury. We talked about gum disease, and gum disease can destroy not just teeth but bone around the mouth and tissues. And a lot of those patients that come here don't think they can get dental implants because they had loss of these bone and tissues around their jaw.
Yeah, it could also, that's what you need for that implant to sink into,
absolutely. Right? We tell it simply that implant needs adequate bone, adequate tissue. And some people even have pathology like cysts or tumors that leave large holes in their jaws.
Yeah. Okay, so how do we fix that?
So that's where we come in, because we're really one of the few specialties that deal with this. And what we do is we use advanced therapies. We talked about in the segments. The new things that we are doing is using two types of technology, which is stem cells therapy and infuse, which is what we call a new bone morphogenic protein. It's a growth factor for growing bone as well.
So literally you can regrow some bone?
Exactly.
Right. So we're taking a look at the...
This is a surgery of basically what we're taking is actually taken from the chin, and then we're actually onlating. Now this material around it is actually bone. Sometimes we can soak that with what we call BMP, which is a new growth factor to grow bone and actually grow a lot more bone around that than they could have previously had.
Yeah.
We use that with a lot of sophisticated surgery as well, so it helps augment that.
Yeah, okay, and then tell us how stem cell works in terms of...
Stem cells, what we've done is basically, I've had a lady which she had a large defect for the front of her jaw was totally missing. So what we did was take stem cells to help regrow that whole section of her whole forward part of her jaw.
Yeah.
That's such a big defect that you need that. So we take stem cells from the marrow, we use that with some of her hip bone, and then actually reconstruct her whole anterior jaw with stem cell therapy.
That's amazing. I'm glad you know how to do that. It's amazing.
The new technology with stem cells is orthopedic surgeons are using it to regrow not only bone, but tissue, cartilage, and the new control studies that are out there that our office is going to be involved with is placing it in like TMJ joints, where people have loss of cartilage in the joints, and then that we're hoping can regenerate that as well.
Yeah, and of course the regeneration part, it means it's natural, your body accepts it, as opposed to putting foreign objects in that might not work as well.
Any type of TMJ surgery is usually a very big invasive surgery, so any type of thing like that could be very beneficial for the patients.
Okay, I want to take a look at like a full mouth restoration. And when you get patients who have been told it's not going to work for them, who come in and it works for them, because literally they're starting with gum.
Exactly.
You know?
They're starting off, like I said, with gum disease where they have total loss of bone and tissue. So this is an example where this is a full mouth reconstruction. It's called all-on-4 or all-on-5. We can do more than all-on-4 because we have the technology to, like I said, engineer bone and tissue. Once these 4 or 5 implants are placed, then you can have what we'll call a hybrid, which is there's a metal substructure that goes across this, which you see here, and then that's bonded into the 5 or 6 implants that are there. That functions just like normal dentition. It's super strong. The implants are not movable, and they are lifetime.
Well, in many cases, the implants are better than human teeth.
In a lot of cases, they are, because a lot of times we see one side that has the implants, the other side, there's bone loss or teeth that are breaking off, well, that's the side that they rely on is the implant side. So it is better.
I'm going to wrap with, I had a couple of acquaintances I know that had some really bad teeth issues and would never smile. And when they were able to finally get their mouth restored, it makes such a difference in their quality of life and such a difference in their self-esteem. You get to see that every day.
Absolutely. I mean, especially with elderly patients, it's really about living longer, but quality of life is the #1 factor for their length of quality of life. And obviously chewing is the really big factor in that.
Because when you chew, that means you can eat some food.
Absolutely. Exactly. That's a big difference.
Dr. Koo, thank you very much.
Thanks a lot, Deborah.
And for more details on Dr. Koo and Piney Point Oral and Maxillofacial Surgery, you can call 713-783-5560, 713-783-5560, or go to pineypointoms.com, pineypointoms.com. Steve, up next, don't let a job or odd hours stand in